Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Very nice to see Meghaswana and many more who are all online. INIC, we have some happiness, some regret. It doesn't matter. We need to arise, awake, and stop not until we achieve whatever that we wanted in life, right? So very nice to see Siddharth Mishra, Meghaswana, and many more who are all online, doctor. So let's make the great beginning. Can the online students can punch? Is the voice loud and clear for all of you? Yes, doctor. So every day we revise at least 100 questions. And next 210 days before January 1st, we will finish 20,000 PYQs. And all these PYQs are made available in the PDF that I shared with you. So there you have only PYQs. You need to mark the correct answer while listening the live class, right? I purposefully did not give the key. So if you don't have the PDF of the live class, all these 20,000 questions we are discussing, please WhatsApp us. We will be more than happy to help you with the PDF. So let's make the great beginning, doctor. The bone which is ossified at birth, it is the lower end of the femur, which is ossified at birth. That you need to know. And what is ossification? The bone tissue replaces the cartilage is called ossification. Enchondral ossification, where do we see? In all the long bones, we see the enchondral ossification. So most of the bones in the body, they're all formed by the enchondral. There are other type is called intramembranous ossification. So there is a replacement of a cartilaginous model with the bone tissue, which is called enchondral ossification, is what you need to remember. Nutrient artery, how does it run? It runs towards the metaphysis. So you have the growing end, which is called epiphysis, the shaft, which is called diaphysis. Between the two, you have the metaphysis, and the nutrient artery runs towards this highly vascular part of the bone, which is called metaphysis. Metaphysis, because it is highly vascularized. Most of the hematogenious infections, they all go to the metaphysis, is what you need to basically remember, doctor. Nice to see Meghaswana, Siddharth. Can you please punch his voice loud and clear for all of you, doctor? Now, what is a traction epiphysis? Trochanter of the femur is called traction epiphysis. So each of the types of epiphysis you should know. The tractional forces will aid in a proper alignment and shaping of the bone. So you should know which epiphyses are broadly classified into traction epiphysis. Trochanter of the femur is that bony prominence on the femur located at the junction of the femoral neck and the greater trochanter. It is the one which is called traction epiphysis, is what you need to remember. Coracoid is not a traction epiphysis among the options given. So which is a traction epiphysis? Once more, lesser tubercle, some bony growth which is aiding in traction. You need to recognize as traction Epiphysis is what you need to remember. Is the broadcast smooth? Is the voice flowing easily? Please give a quick feedback, doctor, because as I told you, I'm working on the domestic internet, right? So now, is aberrant epiphysis. The base of the second metacarpal is a aberrant epiphysis. It is a abnormal development, anomalous development of the growth plate or any secondary ossification center, and it can result in structural deformities. That is called aberrant epiphysis. The base of the first metacarpal is the part of the metacarpal bone. It articulates with the trapezium, forms carpometacarpal joint of the thumb. Whereas the second metacarpal is called aberrant because it is not the part of the bone, is what you have to appreciate. Mastoid process is what type of epiphysis, doctor? It is a traction epiphysis. So let us quickly summarize the different types of epiphysis. Articular epiphysis, the end of the long bone that forms a joint with another bone, distal femur, proximal humerus, distal radius, etc. Non-articular, which does not form a joint, like the greater trochanter and the medial malleolus of the tibia. Appositional epiphysis means it forms a junction of the epiphysis with the diaphysis, the shaft. Then we have accessory epiphysis. That is one way of classification. So what are all the various pressure epiphysis you have? Distal femoral epiphysis, proximal tibial epiphysis. They're all the example of pressure epiphysis is what you need to remember. Now, what is true about metaphysis of the bone? So epiphysis, different types of epiphysis is the favorite topic of the examiner, doctor. Metaphysis is the most vascular part. Growth activity is maximum here. It is the place which is favored by all the hematogenous infection to spread because metaphysis is highly vascular, is what you need to remember. Now, doctor, with regard to the metaphysis, it is the epiphyseal end of the diaphysis, highly vascular, common site of osteomyelitis. Every entrance you go, epiphysis, metaphysis, one of the favorite topic of the examiner. Osteoblasts give rise to osteocytes. That is true. But the growth of the bone occurred, epiphysis, is what you have to remember. Now, doctor, if you look at the interphalangeal joints, they are the hinge joints, hinge flexion and extension in one thing, just opening and closing door. So, this is the examiner would be very sure about. Pisiform is which type of bone, doctor? Pisiform is a sesamoid bone, is what you have to remember. Pisiform is that P-shaped bone which is located in the hypothenar eminence towards the little finger of the wrist. It articulates with the triquetral bone and it is the attachment site for the various ligaments. Pisiform bones are very common in the athletes like gymnastics, basketball, etc., etc. These are all the pneumatic bones which are filled with the air. Maxilla, ethmoid, frontal, not the mandible, not the mandible. Once more, the bone which is pneumatic is maxillary, has got air inside it, a pneumatic bone. Knee is which type of joint, doctor? Diarthrosis. Knee comes as an example of diarthrosis is what you have to remember. What is the joint between epiphysis and diaphysis of the long bone? It is a type of synchondrosis. Synchondrosis is what you have to remember. So synchondrosis are those joints in which the bones are joined by a hyaline cartilage are called synchondrosis is what you have to remember. So in the bone, in the joint, what are the structures where there is a nerve supply? Synovium, if there is a nerve supply, what will happen? Any inflammation of that, like synovitis, capsulitis, or inflammation of the ligaments, that can cause pain. So synovium, capsule, ligaments, all of them are innervated structures, but not the articular cartilage is what you have to remember. Because articular cartilage is not innervated. It is a vascular tissue and it covers the articulating surfaces of the bone. It acts like a shock absorber is what you have to remember. Once more, my question. Is the broadcast clear? Megasvana and everybody, can you please punch? Ear ossicles articulate with each other. What is the joint called? Synovial joint. Malleus, incus, stapes are there, no doctor. They articulate with each other through synovial joints with synovial fluid. Median atlantoaxial joint. It is an example of, once more, a synovial joint. So median atlantoaxial joint is located between the odontoid process of the axis and the anterior arch of the atlas. Atlas is the first cervical vertebrae, axis is the second cervical vertebrae. And this joint will allow the rotation of the head and neck and is important for the stability and the movement of the cervical spine is what you need to remember. Intracapsular articular disc, where do you have it? Where the clavicle meets the sternum, the sternoclavicular joint is intracapsular. Articular disc is what you need to remember. What is a syndesmosis? Fibrous joint is a syndesmosis. So two bones are joined together by a strong fibrous ligament is syndesmosis. Between tibia and fibula, you have syndesmosis. So what is the main purpose of syndesmosis? It will allow a small amount of movement and provide the stability to the joint is what you have to remember. So when this session is happening, no? Thank you, Megasvana, for the feedback. When this session is happening, what you need to do? Beforehand only I gave you the 1800 questions in anatomy. You keep it before that and note what are the right and wrong answers. What is the correct answer? You mark it so that you are very active solving the questions. One round, if you solve the questions along with me, second round it become easy. So that is the whole funda of these sessions, doctor. Omer's ala and the sphenoidal rostrum, what is the type of junction it is? It's called scindialysis. Scindialysis. So scindialysis joint is a type of joint in which one bone is wedged into a cleft. So one bone has a cleft, other has a slit, spike, which will fit into that. So the vomer bone is wedged into the cleft in the sphenoid bone. Joint is the growth plate. Growth plate is a primary cartilaginous joint. where the bones are connected by hyaline cartilage. There is no synovial cavity in primary cartilaginous joint. Manubriosternal joint. It is a secondary cartilaginous joint. Secondary cartilaginous joint. It connects manubrium and sternum. This will also allow slight movement during breathing. It is a fibrocartilaginous disc and hyaline cartilage is there at the between manubriosternal joint, between manubrium and sternum. Inferior tibiofibular joint. It is a syndesmosis between tibia and fibula. Inferiorly, there is a syndesmosis is what you have to remember. So syndesmosis typically is formed by a fibrous joint capsule and ligament that holds the bone together. It will allow small amount of movement during ankle dorsiflexion and plantiflexion is what you have to remember. Sacrococcygeal joint is an example once more, just like pubic symphysis. It is a symphysis between sacrum and coccyx is what you need to remember. What is a compound condylar joint? Compound condylar joint. Elbow joint is a compound condylar. It allows for flexion, extension, small degree of rotation, and the articulation between trochlea of the humerus and the trochlear notch of the ulna. It forms the hinge joint is what you have to remember. Now, which is a synovial joint, which is of condylar variety. You have carpal, metacarpal, and phalanges, no? Metacarpo between metacarpals, and the phalanges. Metacarpophalangeal joint is a type of condylar variety of joint is what you need to remember. So MCP joint is a synovial joint of the condylar variety is what you need to remember. It will allow flexion, extension, adduction, abduction. All these movements are enabled. The first metacarpophalangeal joint is a synovial joint of saddle variety. Interphalangeal joints are the synovial joints of hinge variety. Radiocarpal joint is a synovial joint of ellipsoid variety. So all these things you need to have in tips. Sure, short questions. So what is a joint between malleus and incus? It is synovial joint because between the ossicles of the ear, you have synovial. It is a saddle, horse riding now. Saddle synovial joint is malleus and incus is what you need to remember. Atlanto-occipital joint. It is a type of ellipsoid joint. Ellipsoid joint. So whenever occipital condyles of the skull and the superior articular facets of the typically it is formed between articulation between occipital condyles of the skull and the superior articular facets of the atlas vertebra. This joint allows for flexion, extension of the head as well as lateral tilting and rotation. So the trochoid synovial joint is found at the axis and atlas vertebra. Whereas temporomandibular joint is condylar synovial joint. First carpometacarpal is saddle synovial joint. So all these things you should be very sure about. Yeah, Dr. Medico is saying only two people online. One me, other is sir. Sir watching his own live stream. Good. At least one is good, right? Thanks, Dr. Medico, for joining. Smallest muscle is stapedius. What is the nerve supply of the stapedius, doctor? Seventh cranial nerve. Second branchial arch. Seventh cranial nerve supplies stapedius muscle, which is the smallest muscle. Yes, 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 yes. Smallest stapedius, second, seventh cranial nerve is what you have to remember. Now, doctor, composite muscles include pectineus, adductor magnus, biceps femoris. These are all called composite muscles, is what you need to remember. So, what do you mean by composite muscle? They are those muscles that have more than one anatomical origin and insertion. Pectineus, adductor magnus, they are examples of composite muscles which are located in the thigh. Biceps femoris is a composite muscle in the posterior thigh. Rectus femoris is not composite. It is one of the quadriceps muscle that has a single origin on the iliac spine and single insertion on patella. When do you call composite? Whenever the muscle is having multiple anatomical origin and insertion, you call composite muscle, is what you need to remember. Very nice to see 10 online classmates, including Dr. Medico, right? So when I started clinical practice, there used to be only one patient coming. First week over. Then 3 patients are coming. And within 6 months, there are about 70 to 80 OPD, and people are not getting appointment. So the question is, for any teacher, one student is more than enough, doctor. Nice to see Aditya Kumar. Ikra, thank you, Ikra. Because of your classes, I qualified my FMG. That's a very thankful statement. Ikra, you have truly humbled me. So, thanks for giving a good feedback. So, every day we should study, doctor. That's the most important thing in life. If every day we are studying, high energy day or low energy day doesn't matter. Last 1 month, very good, Aditya Kumar. I'm pursuing MD radio diagnosis. Even I attend your classes for my own DM courses. Wow. Thank you so much for the feedback. Aditya. Since 2K18. Wow. So, whether you are my subscribed student on the Score Learning app or not, it doesn't matter for me. If you subscribe, I'll be very happy because you are paying fee. But otherwise also, we are such a kind of teachers. For us, teaching is an inborn error of metabolism. Every day to see patients, to teach doctors is a part of our life, right? One student is there, half student is there, doesn't matter. Doesn't matter at all, right? One student there, half student is there, doesn't matter to me at all, right? By January 1st, they will try to finish at any cost 20,000 MCQs. Every day, 100 MCQs, we will do the discussion. Dr. Confused Medico says, sir, I don't have marrow or prep ladder regularly. I only taken your app subscription. Hope I get INICET good rank. See, whether marrow, prep ladder, or any ladder, doctor, ultimately, we need to get that self-motivation to read. The moment we get that self-motivation to study, anything finally teaches the same thing. The same thing to do the revision of PYQs, to revise the list of high-yield facts and high-yield topics. Be ready with your own ammunition for the last moment preparation for the exam. The moment you do that, you are going to be the winner. All right? So don't worry. You are definitely going to make a very good rank, doctor. And please count on me. I'm your classmate studying with you. And even other classmates get top rank. If you are still waiting for your number to come, I'm there with you to hold your hand. Shortly, many other new teachers are going to, I'm inviting them to teach with us. And generally, all these big apps, funded companies, they pay 5,000, 10,000 per hour. I said I can only pay 1,000 rupees per hour of live class. So many teachers came forward. They said, yes, we love to spend a couple of hours discussing the questions, concepts with the students every day on the YouTube freely. I'm so happy to listen that. So many more new teachers I'm going to bring. And I will also be there with you. Let us all study on the WhatsApp together every day. Okay. So that is a plan, doctor. And very nice to see some of the others who joined the session. Hi, NRR and NIKR. NRR, what is the name? Yeah. So, doctor, these are all the composite muscles, but not flexor carpi ulnaris. The muscle which is having double nerve supply, which one? Which nerve has double nerve supply, doctor? Which muscle? Digastric muscle. All of you know very well that the anterior belly of the digastric is innervated by mylohyoid nerve, which is the branch of the inferior alveolar nerve, while the posterior belly is innervated by the facial nerve, is what you need to remember. Then thyrohyoid muscle is innervated by hypoglossal nerve. Adductor magnus is innervated by the obturator nerve. That is what you need to understand. Now, so digastric is a paired muscle which is located on the underside of the chin. For all the opening and depressing of the mandible, you require digastric. It has two bellies, anterior and posterior. Occipitofrontalis is not a part of digastric, but is a muscle of the facial expression, is what you have to remember. So what is the most common muscle congenitally absent of all, doctor? It is the pectoralis major. A good number of people don't have pectoralis muscle, which is a fan-shaped muscle in the front of the chest, which is the intra-articular tendon. Popliteus will go into the joint. It has a intra-articular tendon. Popliteus is the one which is responsible for locking, unlocking mechanism. It has intra-articular, which has got a multi-pennate muscle. Multi-pennate muscle. It is the deltoid, which is typically called multi-pennate, where the fibers are all arranged at oblique angle to the central tendon of the muscle in a feather-like manner is called multi-pennate, is what you need to remember. What is the longest muscle in the body? Taylor's muscle, it is also called. Sartorius is the longest one. It is a muscle in the anterior compartment. So if you look at the quadriceps, what will quadriceps will do? Knee extension, plays an important role in walking, running, etc. Now, multi-unit smooth muscle, where do you see it, doctor? In ductus deferens, iris, blood vessels, multi-unit smooth muscle. So multi-unit smooth muscle means wherever you require a precise control, like iris, blood vessels, multi-unit smooth muscle. There are individual cells that contract independently of each other alone. It will allow for a fine-tuned control. Ductus deferens also contains multi-unit muscle responsible for propelling the sperm at the time of ejaculation. Whereas the gut, it contains single unit smooth muscle which contracts as a single unit to move the food through the digestive tract. Single unit smooth muscle, where do you see, doc? Gut is one thing which is single unit smooth muscle. And also ureter is an example of a single unit smooth muscle, is what you need to remember. Which muscle has parallel fibers? Sartorius, rectus abdominis, sternohyoid, the ribbon muscle, they all have parallel fibers, is what you should remember. Shunt vessel controls temperature. It is a direct communication directly between artery and veins. Lot of local mediators like ADP, adenosine, they all control shunt vessels, is what you need to remember. So nitric oxide, prostaglandins, adenosine, they all cause relaxation of the smooth muscle in the vessels of in the walls of the shunt vessels, leading to increase in blood flow, is what you should remember. Thoracic duct. So you should remember, if you look at the whole body, right upper part is slightly different. It is not drained by thoracic duct, lymphatic drainage. Left upper part, right lower part, left lower part, they're all thoracic duct. That's what you need to remember. The right upper part is drained. Then in that case, where is the right upper part drained? Right upper part is drained into the right lymphatic duct, which is the smaller lymphatic vessel that empties into right subclavian vein, is what you have to ultimately remember. With regard to the thoracic duct is a favorite topic of the examiner. It begins as a continuation of cisterna chyli, largest lymphatic vessel. It ends into the junction between the left subclavian and internal jugular के junction point पे thoracic duct करू होके it will drain into. That's what you need to remember. Thoracic duct, where does it open into? It opens into the left brachiocephalic vein, is what you need to remember, doctor. Thoracic duct, it receives the tributaries. From where does it receive tributaries? Thoracic duct. So everything, anything about the anatomy of the thoracic duct, you need to be sure. Bilaterally ascending lumbar trunks will drain into the thoracic duct. Except the right upper body, all the remaining part of the body is drained into the thoracic duct, and it ultimately drains on the left side. Thoracic duct is the largest lymphatic duct. It receives the lymphatics from various parts of the body: intestinal, lumbar trunks, left jugular, subclavian, bronchomediastinal trunks, and left upper intercostal duct. All of them basically drain into Peckwett's duct. So, Peckwett duct, it begins at the level of T12. It enters thorax to the aortic opening. It passes the superior aperture of thorax. It passes in posterior and superior mediastinum, the thoracic duct. And where does it begin? When the cisterna chyli are merging with each other at the level of the L1 to L2, it ascends through posterior mediastinum, passes through the aortic opening of the diaphragm at the level of the T12. It runs upwards and enters the superior mediastinum. That is what you need to know about the thoracic duct. So Peckwett duct is also known as cisterna chyli. It's a dilatation at the base of the thoracic duct, and it receives the bilateral lumbar and intestinal trunks, is what you need to remember. Now, doctor, embalming solution, what does it contain? Phenol, glycerine, formalin, they're all part of the embalming solution, not the ethanol, is what you need to remember. So with this, we will conclude, doctor, our first session. So today we did 50 questions. We took around 40 minutes to complete. But from tomorrow, we will make it a point, at least 1.5 hours, we do the revision. 100 questions, we do the revision. Every Saturday, at least 200 to 300 questions revision karenge. Ultimately, by January 1st, we plan to finish 20,000 PYQs. And all these PowerPoints with explanations, correct answer, is all made available in the Score Learning app. So today only subscribe to the Score Learning app. Every Sunday there is a grand test along with discussion. Please tell all your friends. And every day live class is there. Everything is available free on YouTube. But the only thing is we remove the video after the YouTube class is over. So I request all of you to also subscribe to the online session, doctor. So nice to see Manikanta, Rahul, and Dr. Lokesh. If possible, Dr. Lokesh, where are you from? Yes, doctor. Where are you from? So when you come and join the session, no, doctor, what you do is you keep your video open, get a good internet connection, right? And you can start actively answering the questions. That way, all of us are on the same table. And then this entire thing become broadcasted on the YouTube. So very nice to see Dr. Rajesh Reddy for joining the session all the way from Tirupati. Good, doctor. Right. So, how was your exam? You have taken INI-CET, doctor?
Sir, no, sir.
Ayo. But
I'm listening to your lecture, sir, but I didn't take the exam, sir. I missed it.
very good, very good. So nice that you joined the national broadcast. From tomorrow, be well prepared, a little well prepared for the session, and answer the questions directly by joining the broadcast. That would be very interesting. So,
Sure.
thank you all once more, and see you every day to do revision of around 100 questions.